Donn Marshall, and I'm running for the House of Delegates in Berkeley County's 63rd District. Today I'd like to talk to you about the drug problem and how we can fight back against something that's menacing our families, our neighborhoods, and our communities. What we need is a comprehensive plan.
I know something about the drug threat. For more than a decade, I led interagency teams in the fight against international drug traffickers, and I was decorated for my work. Here in Berkeley County, I serve on the Drug-Free Coalition, where I've participated in the coalition's efforts to raise awareness about our drug situation and to take prescription drugs off the streets.
I know how drug traffickers operate, and I know about the costs of the drug trade. And when it comes to costs, here's a startling figure. The Governor's Substance Abuse Task Force has estimated that substance abuse cost West Virginians $450 million a year. That's almost $500 million a year in direct costs in the criminal justice and healthcare systems. That's a dollars and cents figure. Let's talk about the human impact of the drug trade on our area and our state. Nearly as many West Virginians die from drug overdoses, including prescription drugs, as die in highway accidents. In 2009, drug overdoses were the #1 cause of death for West Virginians under the age of 45. 70% of the parents involved in the child welfare system have substance abuse problems, and 50% of those arrested have connections to substance abuse.
Here in Berkeley County, a large percentage of the county's budget is dedicated to jail costs. It costs almost $50 a day to keep a prisoner in the Eastern Regional Jail, which has a capacity of 300 prisoners. So that's $15,000 a day if the jail is full, and more often than not it is. Now, if 50% of the inmates are there for substance abuse-related crimes, substance abuse is costing us $7,500 a day in jail costs right here in Berkeley County.
Now that we're back to dollars and cents, let's revisit our original number, $450 million in direct costs. If we can reduce substance abuse by 10%, not only will it mean a corresponding decrease in crime and misery, but it'll put $45 million back in taxpayers' pockets. But to fight back effectively, we need more than just police on the streets. We need a comprehensive plan. We need to give law enforcement and the criminal justice system the tools they need to fight drug traffickers who cross state lines at will. Let's establish a joint interagency task force based along I-81 that'll increase information sharing among local, state, and federal authorities who are charged with tackling the drug threat. And since drug traffickers don't respect state lines, much less their laws, let's streamline laws in the Quad State area so that it's easier to build effective cases against drug traffickers. When it comes to prescription drugs, which are killing so many of our young people, we can make simple, costless changes to prescription drug procedures. These changes, they won't affect law-abiding citizens, but they'll make it harder for people to get prescription drugs for illicit use. For example, did you know your pharmacist is required to make an entry into a statewide prescription drug database every time he fills a prescription? These entries are supposed to be made on a daily basis, but the statewide database is only updated on a weekly basis. This means that a prescription drug addict could go to a pharmacy on a Monday with a forged prescription, get his OxyContin, go to a different pharmacy on Tuesday, another one on Wednesday, and so on, and it wouldn't appear in the prescription drug database to warn pharmacists until the next week. We need a real-time statewide prescription drug database that lets pharmacists know when fraud is going on. That's one way, a low-cost way, that we can prevent illicit prescription drug use. We can also close loopholes. Currently, facilities like an urgent care are not required to report to the statewide prescription drug database, which means an addict can go to one urgent care and pick up OxyContin a day's supply, go to another urgent care, pick up a day's supply, and just basically travel through the state picking up days' supplies of OxyContin. We can fix this. We can close this loophole. These are some of the ways we can attack the flow of drugs, but we also need to attack the demand for drugs. And one of the most efficient and effective ways we can do this is with drug abuse prevention programs in our schools and communities. We should implement a series of these programs that will educate kids and their parents throughout their school years. If the surest way to have an impact on drug trafficking activity is to reduce the demand for drugs, then we need to talk about drug treatment opportunities. West Virginia currently has facilities that will treat 7,000 substance abusers. We need treatment programs for 100,000 West Virginians. Here in Berkeley County, there is no sustained residential drug abuse treatment facility that's available to the public. The nearest such facility is in Kaiser. We have a limited ability to control what drug traffickers do, but the ability to dry up the demand for drugs is in our own hands. If a drug addict steps forward and says that he wants to get off drugs, there should be affordable opportunities for him to do just that. We know what the drug trade brings to Berkeley County. Misery, death, prostitution, crime. It's time to fight back. It's time to save our communities and save lives. With your help, with your vote, I'll fight this fight. I'll give our communities the tools they need to attack the drug trade. Because when it comes to the health and safety of our communities, this campaign isn't about your party. It's about our future. It's about leadership, not politics. I'm Donn Marshall, and I'm asking for your support.